When you are done with the wound assessment, the next phase of the procedure is to clean your trolley aseptically. Is that correct? So in cleaning your trolley, you validate this cleaner wipe, okay, the expiry date, batch number present, and also your glass as well. Is that correct? So you put on the second pair of gloves. I believe you understand up to that point. So this is the second pair of gloves because the first one is what the one you use for the what? The wound assessment. So you change both the gloves and then the what? The apron, and then you put on new apron and what? Gloves for the cleaning of the trolley. So in cleaning the trolley, you take 3 pieces of the cleaner wipe. You take how many? 3 pieces of the cleaner wipe. You can take them one by one or in box, whichever way you want. Is that correct? So you take 3 pieces of the cleaner wipe. You clean the trolley, the bottom shelf of the top shelf of the trolley, always from the far to the nearest end in a zigzag manner. Okay, so you go this way like that. Is that clear? Then you clean the side of the trolley. In cleaning the side, you don't stand here and cross your hand because you have cleaned the top shelf. If you stand here and do this way, it's a fail because you've contaminated the clean part of the wall of the shelf. So you can come to the side and clean the sides of the shelf of the trolley in an L shape. So I come here, I do like this, 1 L, and I come here, I do another one like this, 1 L, the second L. Or you can stand here and do 1 L, then another L. Is that clear? The idea is not to contaminate or cross the clean part. The same piece of what? Cleaner wipe you used to clean the legs of the trolley from the far to the nearest end. Exactly. In a single stroke. So you come 1 and this one near. So always far before near. Always far before near. The rationale is not to. So if you clean the nearest one before the farthest one, when you are stretching, you are contaminating the one you have cleaned. That's why we always do far before the nearest one. Now you can throw this one away into the clinical waste bin. I'll get some. Then the second one, cleaner wipe, you use it to clean the bottom shelf of the trolley in the same manner, okay? From the farthest to the nearest in a zigzag manner, in a single stroke. And again, the side in an L shape, like that, just as we did the top one. Do you understand up to this point? Then you use the same one to clean the legs as well. The lower part, the front panel. Also far, near. Always in a single stroke. Don't do this. No. Once. From top to down. From top to what? In a single stroke. Now you can discard this. So we use the first one to clean the top, the side, and the legs. The second one to clean the lower shelf, the side, and the what? The legs. Exactly. All in a single what? Stroke. Then the third one, you take your sanitizer and clean it with the third wipe. Okay? The third wipe is for what? The sanitizer. And place it at the bottom shelf of the trolley. And you discard that one too. So now you know the use of the 3 cleaner wipes, right? Now you are done cleaning. So you discard or dispose what? The second pair of gloves. You do a quick hand gel and then you wear the third one. On the third occasion, you wear only the gloves. Only apron, sorry. You wear only what? Apron. On the third occasion, you put on only the apron. No gloves at the moment. Is that correct? The third gloves will be the sterile gloves in the wound pack. Okay? Good. Now we are done cleaning. You need to do another W200 for what? Antt. Do you understand? After cleaning, you do another W200 for Antt. Then you verbalize that prior to wound dressing, all housekeeping activities such as mopping, sweeping has been stopped, and then all fans was switched off. You say that all housekeeping activities has been stopped and all fans switched off 30 minutes prior to your what? Wound dressing. Please, are you following? Then now, after your W200, you validate your wound dressing items and put them at the lower shelf of the trolley. Okay. So the first item you will need is your sterile wound pack. Okay. Which has not changed color. Everything is intact. Expiry date 2020 what? 7 batch number present. You put them at the what? Bottom shelf of the trolley. The next item you will need is an adhesive tape, which is called the Cosmo. It's also valid. The expiry date, everything is there. You do what? You validate it and say it is safe for you to use. Also goes down to the bottom shelf. And then you will need one piece of fluorescent what? White. You will need one piece of fluorescent white. You will need one piece of fluorescent white. You will need one piece of fluorescent white. You need one piece of fluorescent. Also, you validate everything and you put it there. And then you will need your normal saline solution, which also has expiry date and batch number. You validate it and you place it at the bottom shelf. At this point, these are the main items you are going to need for your wound dressing. In a case where you will need external sterile glass, so the size of the glass in this one is medium. So if you think your hands are bigger than this one, you pick a surgical glass of your size at this point and then you add it. Exactly. Other than that, this is what you need for the wound dressing. Please, we get up to this point. So now you do a quick hand gel and then you continue with the process. Or with your bare hands. You are only in your apron on the third occasion. Now you proceed by establishing your sterile field. Now you proceed by establishing your sterile field. You proceed by what? Establishing your sterile field. So you pick your sterile wound pack with your bare hands. You are only in your apron. So there's an arrow here that shows where you should peel or open it. Okay. So you open the sterile wound pack, making sure you do not touch the inner content. Okay. So nicely place the sterile wound pack on the trolley, making sure this part is facing up. Okay. So making sure this also does not touch the clean trolley. This one you can place it at the bottom shelf. Exactly. In the Antt, one of the golden things you need to do is to do a quick hand gel after each step. It is here. That's why you clean it and brought it to the trolley. Okay. So each step you take in the Antt requires what? A quick hand gel. So you do a quick hand gel and then you continue. Now I'm about to establish my sterile field by opening this sterile wound pack using the tips or the edges. So you see they have made it in a way that one of the edges will show up. That is why when you are placing it, you need to make sure that this part of the pack faces up. So you hold the tip like this and then you open. Then you look for the next available tip of the pack and then you do what? You open it aseptically. When you open it this way, please stretch it. Don't let it come back. Remember you have touched it. So if it comes back to touch the whole thing, it's contamination. So you do what? You stretch it nicely. It lies down. Right? Then you hold the next available tip to open it. Again, you stretch it nicely. Okay? Good. Now it is like this. This one is up. I don't have to cross my hand to touch it. I just have to turn it this way so that this one will face me. Right? The next available tip is this one. I hold it and again I stretch and place it nicely on the field. Okay? If I want to touch here, I still don't have to cross. I just have to turn it this way and stretch it nicely. Do you understand? At this point, if it is not that flat, you can verbalize that you acknowledge that outer 1 inch of the sterile field is considered what? Unsterile. Then you can straighten it this way, vertically. Do you understand? So you just went along the pack, not on the pack. That's why you are verbalizing outer 1 inch of the sterile field is considered what? Unsterile. Please, you understand up to this point? Then you do what? A quick hand gel. Right? Now at this point, you need to access this orange bag to use it at your temporary sterile glass to arrange your items. So we have two types of this pack. One is like this. the sterile glass is on top of the orange bag, so you need to find a way to deal with it. Some packs too, you have the orange bag on top of the glass, so it's just easy. You locate the part that you need to touch and then you are good to go. So if you meet a pack like this, okay, you just hold the tip, which you said earlier is considered what? Unsterile. So you hold it this way, then you use the other hand to pass at the back and pick this glove together like this off the main what? Please, did you get that? Good. Now it is clear enough to hold your what? Orange bag. You do another what? Quick hand gel. So with the orange bag, there's a part that you need to hold. You don't need to hold any other part. There's a part you need to hold. So the orange bag too comes in two forms. With this type of pack, there's a white line. You need to look out for that white line and hold that part. The other pack is a red line. Look out for that. And some of the packs too, this is not an orange bag, it will be a white bag and have a red line. So regardless of whichever you meet, look out for the red or the white line. Okay, so if you come closer, you see this one is the white one. You just touch that white space like this and then you open it. You see, if you touch other places, you come and hold here, which is a fail, because this part is coming to touch your sterile items. But this one, you are going to put a hand in this bag. Okay, good. So when I put my hand in it, this part is where? Up here, which is not going to touch the sterile field. Do you understand? But if I had touched this part, at the end of the day, I'm coming to use it to touch the items, which is contamination. That is why you need to look out for that line, either red or white line. Is that clear? So you wear this as your sterile glass temporarily to arrange your items. In arranging the items, you need to make sure that this one comes a little bit closer to where your patient is. So let's say my patient is here. I need to bring this one quite closer here and arrange my items on the trolley nicely. Right? Good. So in the pack, you have two types of drips. One is waterproof, one is not waterproof. You use only the waterproof one. This just place this one anywhere. Okay, this one is prepared. And then you have 5 pieces of what? Sterile gauze. So most of the time, candidates forget to drape the wound before they dress. So one of the tricks or one of the ways not to forget your drape is that place the drape on top of the gauze, so that by the when you are about to use the gauze, you remember that you have not draped your wound. Still, people take the gauze from the this thing and still dress the wound without drape. So you need to dress. So after this, you make sure you turn this orange bag and use it as your waist beam. Is that clear? Before you turn this waist bag, you need to check the wound. If there's an old dressing on the wound, you use this one to take it off. Is that clear? You use this one to take the old dressing before you turn it. Okay. If you don't turn it, you can't place it on the distance. So you turn this orange bag, and where the white or the red line is, okay, you peel it from below. Okay, there's a space below. You peel it like this. Okay, and then you attach this to your trolley between your patient and the trolley. So let's assume my patient is here. So with the normal trolley, there's a bar here. I don't know if it's on. So there's a bar between the lower shelf and the bottom shelf. Have you seen that bar? Good. You place this one on that bar. You place this one on that bar. This one is not having. That's why I'm placing it here. Don't place it on the top shelf. Place it on that bar. You stick it to it nicely, and then you are good to go. Exactly. Good. The next step is what? Quick hand gel. The next thing you need to introduce onto your sterile field is your adhesive dressing pack, okay? Which also has an arrow showing you how you should peel it. That one too is sterile. You peel it nicely and place it on your sterile field. This one goes where? To the bottom shelf. The next step is quick hand gel. The next thing you need to do is to bring your dressing solution, which is a normal saline. But before you pour it, please use the chlorhexidine wipe and clean it for how many seconds? And allow it to dry for good. So clean it nicely and then you discard that one too onto the bottom shelf. Then there's a dark line here. That's where you need to tear. If you don't tear that place, we struggle to do it because